Hello, it's Clare Pyers here, and today I've got Clare Pyers talking about integrative TCM, conventional blood test and functional pathology tests to hone your diagnosis and improve clinical outcomes. Clare is a Chinese medicine practitioner based in Melbourne, Australia, who has been in full-time practice since 2005. Prior to studying Chinese medicine, Clare studied Chemical and Bioprocess Engineering. The result of combining these two very different career paths gives Clare a very practical, scientific approach that she integrates seamlessly with her heart-centered and soul-focused style of clinical practice. In 2016, she released her first textbook, Integrative TCM Guide to Pathology, which is available from China Books in Australia and also on Kindle. You'll find links to where you can access Clare's resources below this video. Clare is also the developer of an iTunes app which helps you to assess whether your patient's blood tests are within normal range or not. It's with great pleasure I introduce you to Clare Pyers.
Thanks for that introduction, Kath. Welcome to my presentation today on integrative TCM, and it is a fairly new but interesting area of Chinese medicine, and a lot of people are developing an interest in incorporating certain aspects of natural medicine and functional medicine practices into the way that they're interacting with their patients and they're running their clinic. And it's a particular area of interest for me. And I'll tell you a bit about how that came about. You know, as Kath has mentioned before, a little bit about my CV, but I started off, you know, in high school, I was a real maths and science nerd. And, you know, not quite getting the marks for medicine, I decided to study chemical engineering. And, you know, I did enjoy that a lot, and the really full-on maths and all of the science and the brain gym that was required in order to get through that degree was great. But it also taught me a really, anyone who's done an engineering degree will know that it teaches you a very particular way of thinking. It's a very pragmatic approach to problem solving and to analysing certain problems. And so that's something that has stayed with me the whole way through. And as I decided, you know, I got towards the end of my engineering degree, and really just the reality of the sort of jobs that I'd be going into, you know, working for mining companies was kind of not really high on my agenda, and petrochemical companies wanted to steer clear. But even getting into the food industry and the cosmetic industry or pharmaceuticals, really, the more I looked into it, the more I just saw there was so much unethical stuff going on. And so that's how I came to Chinese medicine. I'd had some poor health experiences in my childhood and my teenage years, and found Chinese medicine was the only thing that would fix me. And, you know, a lot of other practitioners have had that same experience as well, that's brought them to Chinese medicine. But having that initial study in chemical engineering and then coming into almost like the polar opposite, you know, yang and yin, you know, really, I think, you know, my brain was going in overdrive as I was learning all of those concepts around Chinese medicine, and thinking about right from the start, you know, how does this fit into, you know, how does this fit into a medical framework? How does this fit into a scientific framework? Because ultimately we're talking about the same people. It's just a different language. And so that was something that was going on in my mind. And whilst I was studying, I was working at a hospital here in Melbourne doing one-on-one work with high-risk patients. And so I had the opportunity to spend a lot of time with patients in, you know, in a really intimate setting. And so I really got to further extend that knowledge gain, you know, and just developing my perspective on how we can look at certain medical conditions and how we can, you know, incorporate TCM and blend TCM and medicine together, and looking for those intersections. So that was whilst I was studying, and then since graduating, I've been in full-time clinical practice since 2005, and so one of the things that I really try and stress to people is that, you know, I am a clinician, I'm not an academic. This is what works for me in my practice, and I've developed this for myself over the last, you know, 10 to 15 years. I've had other practitioners who work at my clinic as well, and, you know, through mentoring them and sharing this information with them, you know, it's helped to grow and develop my understanding of it as well. And so they all encouraged me to get the info out of my head and into a book. And so I spent about 5 years writing a textbook that outlines the framework of just a standard pathology blood test that your patients will have had done if they've seen their doctor, or if they've been to a specialist, or they've got some sort of diagnosis that they're coming to see you with. And so, yeah, I've put that's book one. There's another one coming at some stage on the functional testing, but the standard pathology testing you'll find in that book. So that sort of gives a bit of a background about, I guess, puts into a bit more context where I'm coming from. And I really love this quote by Anne Cecil Sturman from her Red Advanced Acupuncture textbook, and it's a really great read. If you don't already have a copy, I certainly suggest that you go out and get a hold of it. It's a brilliant book. And one of the things that she makes comment on is that the theoretical framework is the knowledge of health and illness, including the detailed understanding of the progression of progression of illness and mechanisms of healing. And that, to me, really, you know, we're talking about the way that it's not just, do I use acupuncture, do I use herbal medicine? It's just really, Chinese medicine has a really flexible framework, and the development of our knowledge base didn't stop, you know, just because the last Materia Medica was updated in, you know, 1955 or whatever. Like, you know, we can still add to our knowledge base because of the way that our theoretical framework and diagnostic methods, I think it's a brilliant way for us to move forward into the 21st century and to become a more integral part of mainstream healthcare. And certainly there's inroads very slowly that are happening here in Australia, and my understanding is that in other countries as well. So there's a lot of exciting things happening in the world of Chinese medicine, and I think that this sort of approach is going to become more relevant as we go along. So these are the sorts of things that I cover in my textbook, and we won't have time to go into all of them today, but I'll just cover a few of them that are of interest to a lot of people, and hopefully it gives you some little gems to watch out for when you're in clinic with your patients, and if they're bringing in their blood tests, that you can have a look and you can watch out for some of these red flags that can show up. And so when we're talking about these, looking at blood test results, the way that I'm approaching it here is not just using the mainstream reference ranges of absence of disease. You know, we're not just asking the question, does this person need to be in hospital? Does this person need to be on medication? We're asking the question, you know, how far away from optimum health is this person? And so there is an optimal reference range that can help us to assess how far away from that, from that ideal health scenario that your patient is. And so those, you can have a patient who comes in and, they've had every blood test done under the sun and every one of them has come back within range, and yet the person in front of you, they're really unwell. It's what brings them to our clinic. And so part of what will allow us to see, to see what's going on from a medical point of view is to use that optimum reference range. And so that's sort of where I'm coming from here. And the way that I, the 5 years that I spent writing the book, some of it was some already published reference ranges from various kind of naturopathic sources and functional medicine sources. And then also I spent a lot of time digging through research and looking at, certain the way that, certain markers can increase your risk of disease, or, is linked with certain health conditions. And so it's a bit of a mix. Some of it's also just from what I've observed with my own patients as well. And so it is the first of its kind, and I'm obviously happy for anyone to give me feedback on it. But hopefully for those of you who already have the app or the book, hopefully you're finding it useful. So the first one that I'll talk about is the electrolytes. And so these are, these reference ranges tend not to change. So across the world, the reference range for sodium is always going to be between 136 and 145 millimoles per litre. And these are very tightly held reference ranges, and they're based on biological imperatives. So people who have their sodium or their potassium, their bicarbonate, if they're out of range, then that person is very quickly going to be finding themselves in a state of metabolic alkalosis or acidosis. And that can be quite dangerous from a health point of view. It can, result in people being, it can be life-threatening, can lead to coma and ultimately death. And so these reference ranges are not the sort of reference ranges that will change based on population. So some, most laboratories will have, various, things like iron and things like ferret and vitamin D and so forth. Their reference ranges that they have, that they use, are based on the population. And so they'll make the assumption that, the majority of the population is healthy, and so they'll take a cross-section of people who are getting tested, and within 2 standard deviations will be considered the norm. And so over time you'll see that certain reference ranges can change, but these reference ranges you won't see change. And so this particular woman, she's come to see me. She's 63 years old, and her main complaint is she has uncontrolled hypothyroidism. And the thyroid blood tests are on the next page, but one of the things that they talk about from a conventional medicine point of view when it comes to thyroid is that you need to, so thyroid from a conventional medicine point of view is just straight out thyroid. So you've either got enough thyroid hormone or you haven't. And you get thyroid replacement if your thyroid's not making enough, and you get a thyroid suppressive medication or thyroid removed, or you get it chemically, like it radiated if it's overactive to control it and bring it back into range. From a functional medicine point of view, when they're talking about thyroid, they're talking about, they often talk about the relationship between the thyroid and the adrenals. And so, that if the adrenals are not working very well, then the thyroid needs to upregulate in order to compensate. So it's a little bit like, if your adrenals are really shot, if you're really tired and you're really run down and burnt out, then your thyroid has to work harder. It's a little bit like driving your car with a handbrake on. Eventually you're going to burn out the engine. And so there's a lot of discussion around having optimized adrenal function when looking at thyroid. And obviously from a Chinese medicine point of view, we can look at those, that the lower fire in the lower jiao, and then we've got the ministerial fire. I'm going blank here anyway, but we've got the Mingmen fire here. And so that heart-kidney axis, and that the need for the kidney yang to be supporting the heart yang is, is a big part of the relationship that we're looking at with Chinese medicine. And so, of course, if someone's coming in with uncontrolled thyroid and she's already seen naturopaths and other Chinese medicine, and, she's exhausted Western medicine, they have no idea. And so I know that that's something that I need to look quite closely at, is what's going to be happening with her adrenals. And often when you get a patient's blood test results, this is going to be the thing that's reported first. On the very first page, the top of the very first page, you're going to get the electrolytes. And they tell us about the way that the body regulates the passage of heat and fluid. And in particular, you can see for her that her sodium has been out of range a couple of times, not by much, but by enough that, you know, the doctors are keeping an eye on it. From a functional medicine point of view, and what reflects optimum health is that you're going to find that your patients who are tired and your patients who have yang deficiency, they might also have that pattern of yang shu with water overflowing, is that they're going to have sodium levels below optimum. And that was the case for this patient as well. You know, she definitely had very clear signs of kidney yang deficiency. And when you're looking through the functional medicine textbooks, there's only a handful of them, but they'll often talk about an optimum level of sodium as being 140 and above. And so this particular patient, you know, since 2012 and earlier, perhaps for a very long time, has had a sodium below 140. And so that can pretty clearly indicate to us that this yang shu that she's presenting with is a very fixed and long-term part of her pattern. It's not just something that's developed, you know, recently. It's something that's been there for a long time. And so whenever I see a patient has their sodium level below 140, so anything that's 139 or less, generally speaking, they will be very tired. They'll like profound fatigue, really having a lot of trouble getting out of bed in the morning. And that's something that you will see quite a lot in your patients, not just patients with thyroid issues or with adrenal issues. Sometimes it can just be straight out kidney yang deficiency. But it's something that you'll find, if there's one thing that you take out of this webinar, is that if you're looking at your patient's blood test results, anytime you see a sodium below 140, you need to support that patient's yang and their kidney yang in particular. Other things that you'll see here on this patient's blood test results is the potassium. I like to see that at around about 4.5 or even a little bit higher, and that's an indication of kidney yin. So I look at the potassium as a potential indicator of yin deficiency. There's an interplay from a functional medicine point of view. There's an interplay between potassium and magnesium, and whilst magnesium blood tests are reliably, the reference range that they use is usually pretty bad. Potassium can be a good marker to see what someone's magnesium status is. And so if you're a practitioner who's using certain supplements in your practice, then you can use potassium as a way of assessing whether or not someone's magnesium status is okay. Obviously, you need to match it up with other signs and symptoms as well. But these are reference ranges that I've seen enough times to be able to be quite confident in, you know, that it can form a good percent, you know, like at least 40 to 50% of my diagnosis based on what their other signs and symptoms are. So one thing that I will say is that even though I do look a lot at these numbers on the blood test results, I still am always looking at the patient in front of me, and making sure that what I've got here on the paper is matching up with what I'm seeing and what the patient's reporting. So pulse and tongue are still really important, palpation as well, but also, you know, just making sure that it all matches up. I'm not going to be diagnosing solely based on a blood test result, and hopefully you guys aren't going to be doing that either. These are her other results, and so you can see that she has thyroid antibodies present. So for those of you who aren't used to seeing blood test results, they tend to, if they've had serial tests done over time with the same lab, a lot of the good labs will often report all of those all on the same page. So you can see the change in time, and you can see her what's called the thyrotropin, and they've got two different line items there for it, and they've just changed the way that they test for the for that particular test. They've just changed the testing method, which is why it's on two different lines for all of them. But it's still measuring the same thing. So thyrotropin is another word for TSH. And so the TSH for this patient is consistently high. So the reference range that they give, it can vary from lab to lab, and some of them it'll be, the upper limit will be 4.0, some of them it's as high as 5.5. For generally speaking, for optimum health and what reflects a really good thyroid function and a really healthy metabolism is a thyroid at the TSH or the thyrotropin between 0.5 and 2.0. And so as far back as we can go, for this patient, she hasn't had that thyroid, the TSH in range. And so we know that it's out of whack for her, and that's part of why she's coming. Now, the T4 is the storage form of thyroid hormone. And so the T4 is, so T stands for tyrosine, and the 4 means there's 4 iodines. So there's 4 iodines attached to the tyrosine. And that's the storage form of thyroid hormone that's created in the thyroid. And then in the peripheral tissues, skeletal muscle is different types of tissues will convert the T4 into T3, and it's the T3 that's the biologically active and most potent. Generally speaking, having the TSH, the T4 and the T3 gives a really good indication of what's happening with the thyroid, because you can see whether or not, so the TSH is out of range for this patient, but her T4 is actually either within range or slightly below. And it'd be interesting to see what is happening with her T3 and whether or not that T4 is converting to T3. It can be quite difficult, particularly in Australia at least, with the laws around what Medicare will provide, and often patients are having to pay out of pocket to get those, to get that full spectrum of tests done. It's beyond the scope of what we can go into today, but you can actually look at the ratios between the TSH, the T4 and the T3 to get an indication of whether or not there might be adrenal issues, or whether it might be an iodine deficiency, or whether there's, overt autoimmune activity that's going on that's preventing the thyroid from being able to do its job. So the TSH is produced in the pituitary gland, and the TSH is the instructions that give, it's the pituitary gland telling the thyroid how hard to work. So for her most recent test from September last year, her TSH is 10.6. And so that means there's a lot of stimulation that the pituitary gland is, giving to the thyroid. It's saying, come on, do your job. And the T4 is a reflection of, how much activity is going on in the thyroid gland. And so even though the thyroid is being instructed, it's, being yelled at essentially, it's just not producing anywhere near enough thyroid hormone. And so for her, there's a few possibilities here. It could be that she's low in iodine, but the other thing that we see here, which is really great that they've done the antibodies testing, is that we can see that she has elevated TPO antibodies. And so there's also, it's kind of chopped off a little bit on the side, but it's TPO, and then the other one is TG, which stands for thyroglobulin. So the TG is thyroglobulin, the TPO is thyroid peroxidase. And so the thyroid peroxidase is the enzyme that helps to activate the manufacture of thyroid hormone. The thyroglobulin is actually the location. It's like the preparation table, I guess. It's the substrate where you get the iodine and the tyrosine kind of come in, and then the TPO is kind of like the magic wand that makes it all happen. And so it's the enzyme that has got the antibodies being produced against it. And so we can see that there's a lot of agitation and, chi constraint, possibly some heat is going on in her thyroid, or is being steamed up from her digestion, from her middle jowl up into the thyroid, that's inhibiting the thyroid from being able to do its job. And two things that I can tell you about thyroid antibodies that I've noticed over the years with my patients. The first thing, and this is quite well researched in the literature as well, is that the thyroid peroxidase enzyme the antibodies to the TPO enzyme can be reduced significantly and almost eradicated for some people by going on a gluten-free diet. So gluten is something that causes immense agitation to the thyroid, and anyone who has a thyroid issue is, generally speaking, going to be better off without gluten. So for this patient, she does need to be off gluten, and it does need to be 100%. Like, it can't be, oh, just going to have a little sneaky pastry on the weekend, or, you know, special occasions and so forth. It may be that she doesn't have the leeway to be able to do that. The other thing that I've found with autoimmune, and this is something that's happening a lot more, well, I'm seeing a lot more of it in my clinic, is that there's a lot of stuff going on in the digestive systems of these patients. And so they're presenting with quite complicated patterns. It might be that they're showing, you know, constrained heat in the middle jiao. There could be lots of dampness. There could be concurrent yin deficiency, some blood stagnation, qi stagnation, you know, some quite messy patterns. And a lot of them fall into the category of GU syndrome. And for those who've seen me present before, you'll know that I'm a big supporter and follower of Heine Fruhauf and his, you know, and his teachings on, you know, identifying and treating GU syndrome. And for a lot of patients with autoimmune thyroid conditions, if they're not responding to that kind of, that standard, you know, approach. So for this patient, you know, she's got yang deficiency, blood deficiency, spleen qi deficiency. You would expect her to start feeling better and to have her blood test come back into normal range as you're treating her. And the thing that helps to unlock, particularly for the antibodies, if they're not coming back into range, is to just add that extra layer of that GU syndrome protocol to your treatments, and that can help to it can just help to unlock those tricky cases that at least I'm seeing more and more of them. Maybe it's because you're all referring your hard patients to me. Okay, so that's as we support her yang, possibly also giving her some sort of iodine, whether that's like an iodine-based herb, kunbu, you know, all of the seaweed type herbs will have some iodine in them, and even just getting iodine from the diet, you know, eating seaweed, eating fish, can be enough for some people to be able to give enough iodine. As her yang improves, as her blood improves, you would expect her T4 to come up, her TSH to come down. In terms of her, so moving down to the bottom panel is her blood count. So we've got the red and white blood cells here. So the hemoglobin, the white cell count, and all of the other different measurements down there. And we can see that in the past, as well as the most recent test that she's had, the white cell count has been below the reference range. And so this is, you know, that first line of defense against invaders in the bloodstream. So she's got antibodies that are attacking herself, but then she hasn't got enough kind of, you know, military going on in her system to be able to fight actual intruders. So it's interesting that her resources have been diverted away from really what they should be doing. And so that, you know, you could think about that as a type of qi constraint, that, you know, the qi is kind of stuck in a place where it doesn't belong and is not getting to somewhere else where it needs to be. I see white blood cell count when it's low as being an indication of qi or blood deficiency. And so again, this is another thing that kind of fits in with that idea of, with this patient's diagnosis of blood deficiency, spleen qi deficiency. And so you would expect, as you're treating her and as you're seeing those symptoms improve, we can gauge that. You know, she's coming into the clinic, she's having acupuncture, you know, we're seeing her for repeat herb consults. I get to feel her pulse, look at her tongue, collect her symptoms, and we can get an idea of when will be a good time for her to go and have a blood test redone, and we can see how much improvement we've been able to get for her. Another thing that I'll point out on here is towards it, so right at the very bottom of the white cell panel. So you can see those lower 5 markers here. We've got neutrophils, lymphocytes, monocytes, eosinophils, and basophils. So those 5 cell types there are all subcategories of the white cell count. And so when you're looking at those figures, as well as looking at the outright numbers, which is important, it's actually more important to look at the overall percentage of the white cell. So the neutrophils as a percentage of total white cells. So the neutrophils being 2 and the total white cells being 3.9 means that her neutrophils are roughly 50%, about 50-something% of her white cell count. And that's a little bit lower than optimal. We can also see that her monocytes are 0.6, which means that it's well and truly above, heading towards close towards 20% of her white cells. And so that's really high. It's way too high for monocytes. The job of monocytes is to kind of gobble things up. And so this, obviously her body has kind of shifted that, shifted the way that she is making her blood cells and kind of prioritizing, the monocytes over other types of white cells. And so that can be, that increased monocytes can be a sign of, either an acute or a chronic infection or acute or chronic inflammation, usually more chronic inflammation, particularly in this type of scenario. And so that can be another way of assessing someone's risk or their likelihood of having, like a lingering pathogen, whether or not it kind of fits into the category of GU syndrome or not. But looking at the monocytes, also the eosinophils and basophils, the 3 of those together can give an indication of how much work you might need to do in terms of clearing out potential lingering evil chi, in the form of like a lingering pathogen. So from a Chinese medicine point of view, we can see here that the way that we can interpret these, it's all very well and fine to say, okay, we've got this understanding of, what the thyroid does and what the T4 and the T3 is, and the antibodies and so forth. But bringing it back into Chinese medicine helps us to not only to, be able to formulate a really effective treatment plan, but it also just kind of gives us the ability to stay true to our medicine and to not be always looking for, not be looking for those functional medicine or integrative medicine quick fixes, where people say, oh, well, such and such, they might say, oh, well, this type of mushroom is really good for increasing white cell count. Or, if you've got low T4, you should take this supplement. It's really good for increasing T4. We've got some really awesome tools in our toolkit. Chinese herbal medicine is awesome. Acupuncture is awesome at fixing so much of this stuff, but it's just not written about in terms of the internet, at least. It's not written about in an easily accessible way that says, if your patient has this marker out of range, you can do these, you can look for these types of patterns. And so that's something that I'm very passionate about, something that I'm doing all the time in my mind. And that's something that I encourage all of you to do as well, is to always try and bring back these, these test results, bring it back into a Chinese medicine diagnosis, so that then you're then using the tools that we have, they're the tools we're trained in, that's what we're experts at. And we're really comfortable and proficient at being able to use these things. And so these are the ways that that you can interpret these blood test results. So even if you hadn't seen the patient, sometimes you might get their blood tests come through before you meet them, and you can get a sense of, okay, well, this is what might be presenting, in the patient who arrives, and you can hone in on your questions, or it could be something that you get after 1 or 2 sessions, and that can help you to further refine what you've already been doing. Cholesterol is another very popular, well, high cholesterol is a very popular diagnosis. And it's something that, you know, there's a lot of debate that goes on between the natural medicine world and the conventional medicine world. You know, the pharmaceutical companies would love to have, you know, half of the world's population on statins. And, you know, I'm not going to go too much into the politics around, you know, the prescribing of statins and the usefulness of having a low to moderate cholesterol level. But the research does back up that having low cholesterol levels or low normal cholesterol levels, I think it's something below about 4.5 millimoles per litre, is associated with the increased risk of all-cause mortality, and also increased risk of infection, increased risk of depression and suicidality. So it's certainly not something that I like to see in my patients having a low cholesterol. I'm quite happy for them to be right up at that top end of the reference range, even sometimes a little bit over, within reason. This is a patient who presented to me maybe a couple of years ago now, and she came in, her total cholesterol was 10. Doctor was freaking out, wanting to put her on medications, and she was very reluctant to do it because, you know, she was still breastfeeding and, you know, wanting to look at a more natural approach. And so one of the things that we can look at when it comes to cholesterol is looking at where cholesterol goes in the body. The majority of the cholesterol that your body makes is made by your body. You know, 10% of it comes from your diet, the rest of it is made on purpose. And the 3 main things that cholesterol does in the body is it's used as, it's like structural support scaffolding for your cell membrane. So every cell in your body, in the cell membrane, contains cholesterol. And so your body can make more cholesterol as a way to try and increase the rate of repair of cells. Another thing that cholesterol does is that in the skin, in the presence of sunlight, it gets, particularly UVB light, it will convert into vitamin D. And so if you're low in vitamin D, if your body has an increased need for vitamin D, then your body can up your cholesterol production so that when you do get out in the sunlight, you've got heaps of cholesterol there ready and waiting to be converted into vitamin D. The third thing that cholesterol does, or the third main thing that cholesterol does, is that it's a precursor to all of the steroid hormone production in the body. And so it's, if you're looking, and maybe I can send this through later, I don't think I put it in the slides, but you go from cholesterol to pregnenolone, and then you kind of branch off and you get progesterone and estrogen, testosterone, cortisol, but all come from a higher upstream. You find cholesterol is the precursor to all of those hormones. And so if your body is low in any of those hormones, one of the things that it might do to try and compensate is to up the cholesterol production so that there's more ingredients to be able to make those hormones. And so when I'm assessing someone who has high cholesterol, I'm looking out for one or more of those 3 possibilities. Does this person have inflammation and cellular damage? Does this person have low vitamin D? And does this person have low hormone levels? It can also come from, you know, low cortisol can come as a result of adrenal fatigue and burnout. And so that's a really common cause for elevated cholesterol. And it's probably the one that I see the most often in clinic. And it certainly was the case for this particular patient. You know, she's got a 1-year-old, she's back at work, you know, she's doing the juggle. It's, you know, she's still feeding at night. And so she was really, really tired. And I think her body was upregulating the cholesterol as a way to try and compensate for, or as a way to try and, you know, get more, you know, cortisol and progesterone to be able to support her to get through her day. From a Chinese medicine point of view, cholesterol is you know, it's quite a yin substance. It does have some of the properties of damp and phlegm, and certainly that, you know, a cholesterol of 10 by any stretch of the imagination is not ideal. It's not a reflection of optimum health, but in and of itself, I don't see it as a problem. I see it more of as a marker of something else. And so for this particular patient, it was really a, you know, a reflection of her, just of her profound yang deficiency, and that the damp and the phlegm that had started to pull as a result of that yang deficiency. One of the other little tricks that you'll see here is her triglyceride levels are 0.8. Her, you know, she did tell me, hey, look, I've got an amazing diet. I don't know why my cholesterol is so high. You know, they've given me these recommendations of things I need to do, but I'm already doing most of them, apart from she wasn't eating low fat, which of course is not a good idea for anyone who's breastfeeding. But one of the things that you'll find is if your patients have got a high sugar intake and it's been happening for a while, or it's happening, their sugar intake is a cause of inflammation in their body, you'll see their triglycerides elevate. And so her triglyceride levels is below 1.0, which is that kind of ideal limit. You'll see further down below that they say, oh, anything below 2.0 is fine. Actually, what you'll find is that you want to get the triglycerides below 1. And so if your patients have a triglyceride intake, have a triglyceride measurement of 0.9 or lower, then you can pretty much be feel confident that your patient is not binge eating Tim Tams every night, or, you know, eating a block of chocolate or whatever it is that people are eating, and that her blood sugar regulation is likely to be okay. So that can give you some clues as to patients' diets, and just that little check-in to see if your patients are doing the right thing. It can be a really good little conversation starter. Sometimes if you see someone's triglycerides are slightly elevated, you can say, well, you know, you're busted. Like, I know what you're doing. You're eating sugar. I know. I have a little bit of a laugh about it, but with my patients. But that's something that is another little gem that hopefully you find useful. So just to revise all of that, is that with cholesterol, you need to make sure that you're checking the other things that is going on that's causing the cholesterol to be elevated, because these are the three main things that cholesterol does in the body. And generally speaking, you know, 99% of the time, I'm yet to find someone who's got high cholesterol just because, but then, you know, a lot of people are coming in, they're already on statins. But you'll find that there is usually one or more of these things that's going on. It's very easy to fix, very easy to get their cholesterol levels down. And in fact, for this particular patient, she was due to see her GP again in a month. Her doctor did the tests and he's like, you cannot go more than 2 months. We need to check this again. And we were able to get her results down to, I think, 5.9 or something like that within a month. So we gave her some adrenal support, and that I gave her that in the form of adrenal gland extract. So it kind of like fits into that that idea of, if you've got a problem with your heart, then eat heart. If you've got a problem with your liver, then eat liver. And that, you know, those surely are principles of eating the organ that has the problem with it to get the nutrients that's going to help that organ to function better. And so from these blood test results, you can see that her sodium is 138. So if we remember back to the start of the webinar, we know that a sodium less than 140 is associated with yang deficiency. And so this is an indication that quite possibly her high cholesterol is a result of her low adrenal function, low hormone levels. Her vitamin D, I don't think haven't got her vitamin D here, but I just put her onto vitamin D. She was had quite a dark complexion and not a lot of sun exposure. And so in Australia, at least, almost everyone is profoundly vitamin D deficient. And so, yeah, we gave her some vitamin D, gave her some Chinese herbs as well, to support her yang, nourish her blood, because she was so busy, so stressed out. It was all just patent herbs. There was nothing, it wasn't a cook up of gui pi tang that was modified. It was just straight out capsules of gui pi tang, some magnesium, some adrenal cortex. And then a month later, her cholesterol was back in range, and that's even better than I remember it. Cholesterol down to 4.4. So she was thrilled, GP was thrilled, off her case, and so that was a roaring success. It's not magnesium. It's not necessarily straight Chinese medicine. There is Meng Xiao, I think, is like a form of magnesium that we have in our materia medica, and that's more of a purgative type of a form of magnesium. There's different types of magnesium that you can get hold of nowadays. It's not just the magnesium oxide that we can get. There's lots of different forms of magnesium, and the type of magnesium that she had is the amino acid chelate. And the majority of my understanding of the way that magnesium works is that it moves liver qi. It also somewhat nourishes liver yin and kidney yin as well. And so that was an easy thing for her to add into her diet, or into her routine. So the third thing that I want to talk about today is the liver function tests. And this particular case is quite interesting. And it is a patient who'd been seeing me off and on for quite a number of years. He had a very strong history of fatigue and anxiety, and his pattern that always came back was yin deficiency. I'd put him on some herbs, we'd do some acupuncture, he'd thrive for, quite a few months. I wouldn't see him for, months, sometimes years at a time. And then he'd come back inevitably when one of the wheels got squeaky. And and this particular time I hadn't seen him for, I would say, maybe 3 or 4 years. And he'd been to the doctor and had an abnormal liver function test come back. So you'll see here from the 17th of the 6th, 2015, were the results that he came in to see me with. So his ALP, GGT, and ALT, all very high. The AST is within range, but it's still above the range that I like it to be at. I like the AST to be below 30. The GGT and the ALT as well, I like them to be below 30 as well. So super, super high. And the only thing that his GP suggested to him was to stop drinking and start exercising. And my patient he's a non-drinker and he exercises. And then he said to the doctor, hey, I'm already doing those things. And the doctor kind of just dismissed it, got him a referral to a liver specialist, but he couldn't get in for a few months. And so he came to see me to try and do something about it in the meantime, because obviously his doctor was quite alarmed about it. He was getting some pain underneath the ribs as well. So this is something that is very, he has an underlying pattern of yin shu and yang shu, and also has some qi stagnation just from there just not being enough. There's just not enough gas in the tank to get, to keep things flowing in his body. And so I gave him, I don't know if I wrote it on here, I gave him a Chinese herbal formula just in patents. I think it was something like, if anyone's interested, please get in touch with me, but it was very straightforward. I think it was something like Yang Yin Qing Fei Tang, or even Qing Mai San. And also he has a farming background, and so there were some other indications in his history, he of having exposure to heavy metals and exposure to pesticides and so forth. And you'll see that going back in the history, it's not that they've redone they didn't redo it in 2015. In early 2014, they did his cholesterol, and his cholesterol is 3.6. That's really low. And that often I see low cholesterol linked with blood dryness or yin deficiency, just having that lack of fluid and lack of lubrication in the body. And you can sometimes see that with patients who've got heavy metal toxicity and exposure to pesticides and so forth. It's like those heavy toxic molecules just kind of really, they just sedate the yang, and the yang can't kind of do anything. And so you end up with this yin and yang, almost like an everything deficiency, because nothing can move. It's all just kind of pinned down. And that's something that I found for him in particular. I hadn't actually seen his blood tests before this time, but that seeing that evidence there on the blood tests that potentially, his yang deficiency and his yin deficiency could be framed in that background of, or could be based in that background of that toxicity. So I decided to add in in addition to the Chinese herbs, to also add in some additional nutrients to support his liver and his body to be able to detoxify and excrete those compounds, because it was obviously quite serious. We needed to get those levels down, and quite quickly. And you can already see the punchline that within 2 months or so, we got his levels down. The GGT did come down a bit lower eventually. It had been elevated in the past anyway, but we did get them down. So the way that I interpret these test results is seeing that he's got, chi stagnation, blood stagnation is indicated by elevated liver enzymes. The GGT you'll often see elevated, up above 200 in people who have cancer. And so that was obviously something of concern that needed to be ruled out. And obviously his doctor was taking care of that. But that's definitely something to watch out for if you've got patients who are coming in. If you are ordering your own tests, you can't just leave that be. If it's really a long way above that top range, you need to refer on for further investigations. Majority of the time, if you're just looking at test results that patients have had done by their mainstream healthcare provider, then all of that is taken care of by those other providers. Other things to note on his results here is that his potassium is really low. So again, that kind of links in with his history of yin deficiency and dryness, and the chloride being low as well is a marker of yang deficiency and internal cold. So he does have that yin deficiency, yang deficiency concurrent pattern that just leads to everything not flowing. So that was a really that case, really interesting, the way in which we can I guess combine those two approaches, combining Chinese medicine and using Chinese herbs and using acupuncture was really good for getting rid of his pain. But, just kind of zhuzhing it up a bit, boosting it a little bit with adding in a couple of supplements. And that's something that, I've had additional training in. It's not something that, not everyone is happy or comfortable being able to use those products with patients, but definitely there's the Chinese herbs and the acupuncture go a very long way to treating the majority of what you'll see in clinic, and the rest of it's just to kind of fix up the outside, fix up the periphery. It's mainly going it's mainly coming into play where you've got people who, for various reasons, you know, they can't make changes to their diet, or they're stuck in a certain, they're stuck with certain lifestyle constraints, and that's sort of where I'm using the nutrients and the supplements more so than as my first port of call. Ideally speaking, if we could all just meditate on a mountaintop and tend to our homegrown veggies and you know, just live a very relaxed and happy life, we wouldn't have the need for nearly half of all of this intervention that we're all involved in with our patients. This is another, so talking about iron, ferritin, in the context of thalassemia and hemochromatosis, these are really real bugbears of mine, particularly when it comes to thalassemia. We all know that low iron is associated with fatigue, and you know, a lot of people feel, you know, can feel quite tired, and they'll go and have their blood tests done by the doctor, and the first thing that the doctor will test is their iron if they're tired. They also will have their thyroid function tested, but the function of iron in the body is not just to transport, you know, it's involved in the transport of oxygen through the bloodstream and hemoglobin and so forth. But you actually need iron in order for your thyroid to work properly. And iron also plays a very big role in detoxification. So the cytochrome P450 enzymes, which are your liver enzymes that detoxify all of the, you know, the chemicals and medications and the various compounds that we're exposed to in our diet and environment. Those the cytochrome P450 enzymes, each of them have iron, have a heme unit in the center, and so it's really important to have adequate iron on board so that we can make enough of these detoxification compounds. So there's more than just energy levels is affected by iron levels. There is an inherited blood disorder that's quite common in people who are of Mediterranean descent. It's called thalassemia. And, you know, people will know if they have it. And generally speaking, what they're told is to avoid taking iron supplements. And what's happening with thalassemia is that there's abnormal hemoglobin production, and that it causes a problem which means that iron doesn't get readily formed into hemoglobin. And so there is the risk of having an iron overload if they do have iron supplementation. However, what I find is that a lot of these patients, when they're coming into the clinic, you know, they're presenting with fatigue and they're presenting with signs of blood deficiency, even in men, and that when you get their blood test results back, it's quite often that they'll come back with low iron. And so that's something that I guess I have the confidence in doing it now, just from clinical experience. But I'm quite happy to give someone thalassemia an iron supplement if they're low in iron. I just give it to them for a very short period of time and make sure they're going and getting it retested again, you know, in a very short period of time, like within 4 to 6 weeks. But that's something that can make a really big difference for your patients. So it's something to watch out for, that if you are treating people who have thalassemia, don't feel like they can't have iron and don't feel like they don't need iron, because a lot of them do need iron. Generally speaking, they do have problems with their middle jowl, with their spleen TNT function, that transformation and transportation of you know, nutrients from the diet. And so that's something that I'm doing with herbs and acupuncture, and a lot of them do well just with an unmodified Bargen tongue if that kind of fits their pattern. It doesn't need to be, you know, the world's most amazing herbal medicine formula. Sometimes, you know, just sticking with the basics can do a really good job. The other thing that shows up from time to time is hemochromatosis, and that's well, at least in Australia, it's the most common inherited blood disorder. And so that can also lead to iron overload, but that tends to be more of a full, like a full pattern, an excess pattern where there is more blood stagnation or blood heat. Sometimes there can be internal cold that leads to kind of like stagnation of the blood via that mechanism. But with hemochromatosis, generally speaking, they will present with some sort of very identifiable pattern, like a Chinese medicine pattern, and just give you herbs and acupuncture as you would based on their diagnosis. And generally speaking, if they have got iron levels that are at the top end or above the top of the reference range, they'll come back into range pretty quickly. There's also, for people who've got really high levels, generally you're wanting them to be under the management of either, their doctor or a hematologist. But, donating blood and bloodletting are two ways of being able to get the levels down. This is a patient who came to see me, and she had tremor and numbness in her hands, and her hair was falling out, her arms were aching. She was about to go back to IVF. She already had a couple of children, and she was going to go back and have a third. They still had some embryos left over in the freezer, but she was really she was very distressed about this tremor and the numbness, and she was worried about her ability to care for her kids, and, what does this mean? She was worried that she might have MS or some sort of degenerative disease. It was a very straight out case of blood deficiency from a Chinese medicine point of view. Her tongue was pale, her, she had dizziness on standing, she had dry skin, dry hair, her fingernails were, flaking off a little bit. She also had signs of spleen qi deficiency as well. And you can see here that her hemoglobin is really low. Her MCV is super low. I hadn't actually seen an MCV that low before, because obviously I'm dealing predominantly, as all of us are, we're dealing predominantly with healthy people, or people who are healthy enough to be kind of walking around. We're not, unless you're treating people who are in hospital, you're not going to be seeing too many patients who've got measurements that are way out of range. Her white cells are out of range as well. And her ferritin, down the bottom of the page, her ferritin's at 21. Now, the reference range that they give here is, between 15 and 165. Some labs will have the lower end of the reference range as 30. But what you'll find is that people who have a ferritin of 50 or above, or between about 50 and 100, are going to have, good energy levels. Anything below 30 at least is, people are going to really struggle to get out of bed. They're really tired and really depleted. And so ferritin's like an iron store. It's like the storage form of iron. And so there's not much left for her in reserve. And her iron levels, despite having thalassemia, her iron's at 11. Now, in some places, if you're wanting to go and donate blood, you need to have your iron levels at a certain level. And certainly if her iron was at 11 and she went to try and donate blood, they would probably turn her away. It's too low to be able to donate blood. Just recently, in the last couple of years in Melbourne, that lower end of the reference range has been dropped down. It used to be at 10 and now it's at 7. I don't know how anyone can operate with an iron of 7, let alone an iron of 11. Ideally, you want it up at around 19. And so, even though she had thalassemia, we went through her blood test results and I said, hey, this is a really big problem for you. You do not have enough iron. I know that you've got thalassemia, but we need to have you on iron for a little while. I gave her Bargenton and I gave her iron. And we retested her iron in a month. I said, you need to go back to your doctor and say that I'm taking an iron supplement, I want to be retested, and the doctor was happy to do that. You can see here that the transferrin saturation and the transferrin. So the transferrin is an iron-binding protein, and so that's the protein that kind of transports iron around in the blood. The transferrin saturation tells us how many spare spots there are available on the transferrin. So we can see that her transferrin is low, like it's almost below the bottom of the reference range. So there's not a lot of transporting ability for her body to be able to transport that around. And so that's another, the way that I interpret that is it's like that spleen chi function of transporting nutrients around in the bloodstream. So that's, being able to, transferrin's a protein. And so being able to get enough nutrients out of your diet to be able to make those proteins and to be able to transport it around, that to me is just a very, very straight out spleen TNT function. So her transferrin is low. That's another indication to me that her spleen chi is suffering. And her saturation is low. So it means that there is spare capacity. Her body has got lots of spots to be able to take more iron on board, but she would do even better again if we supported her middle heater, supported her spleen chi to be able to make more transferrin, to be able to transport around those nutrients that we're going to be giving to her. And so this is where I think that melding Chinese medicine and our Chinese medicine analysis of these blood test results can help to give her an even better outcome. It's not just enough, I think, to be able to to give her some iron and just kind of hope for the best. If we can give her iron alongside a chi and blood tonic herbal formula, then that's going to give her an even better outcome, because it's going to help improve her transferrin levels and make sure that the iron gets utilised. Ferritin is what's called an acute phase reactant. And so it's not necessarily always the case that, that a ferritin that's in that ideal range is reflective of ideal iron levels. And so, in fact, this particular patient here, I'm just using this as an example, ferritin levels are 167, which is a little bit too high for my liking. But, a lot of people would see that as an indication of really good iron stores. It's and for this particular patient, the fact that they had the full iron studies done was a really good idea, because we can see that the iron's really low, but the ferritin's really high. Now, that doesn't necessarily mean that all of her ferritin's kind of stuck, and not able to get anywhere, but it's more of a reflection of, there's, this underlying inflammation in the body. So an acute phase reactant is, the body upregulates it in time of great stress. So if there's some sort of trauma or inflammation that's in the body, then these acute phase reactants, so ferritin is one, ceruloplasmin is another, there's others as well, that they get upregulated really quickly, just in that acute stage. And then once that acute stage has passed, then it will go back down again. You'll sometimes see them elevated with patients who've got cancer as well. So if it's up and it stays up for a long time, then you will want to make sure that, if it's still within the normal limits. So for this particular patient, it's not necessarily crazily above the reference range, so her doctor's probably not necessarily going to worry about it, but we can look at it as an indication of perhaps there's some blood heat or some blood stagnation that's going on that needs to be addressed if it doesn't come back down again. So it is important to not only look at the ferritin levels, but to look at all four of them together. So this particular patient, we've got the ferritin of 167, the CRP of 12. So CRP is C-reactive protein, and that's another general kind of like inflammatory marker. So it's really good to look at these tests, together. We don't just look at one thing in isolation. You look for multiple indications across the whole lot of tests, and also in combination with pulse and tongue and symptoms and so forth, to make sure that the patient's getting the best level of care. So for this particular patient, they could probably do with some iron supplementation, but something needs to be done about that inflammation, because you want the iron to actually be, to actually stay as iron and not just kind of be turned into ferritin as part of this, this firefighting phase that the body is in. So for this particular patient, my approach, it depends on what they're presenting with, but, my approach would be to collect their signs and symptoms and look for, the inflammation that might be going on in their body before just blindly giving iron, even though that iron's really low. So that about sums it up for me. There's obviously a lot more that I could talk about, and I could go on all day, but it's probably time for some questions, Kath. But in the meantime, if you're interested to know a little bit more about my approach, I have got my book has been published. In Australia, you can get it from China Books. You can also purchase it from my website, but the ebook is available in Kindle format. And there's also there's an iPhone app that I've got in the iTunes store, and that's just got the basics of the reference ranges. So it goes through the the absolute reference ranges of what is way too low and way too high, but also what is the ideal range and what are the patterns that are associated with with each of the markers. If they're outside of that optimum range, what sort of TCM patterns are we likely to see with that? So thank you for listening, and
excellent, and thank you, Claire. I've got a series of questions I've just jotted down here. That was an incredible presentation, and also just to anybody watching, just if you look below this video, you'll see that I've linked those, so you can just click on each link to to go through to Claire's resources. So I just wanted to pick up what you were just talking about, your app. One of the things which became really familiar, when you first started, my excitement in terms of wanting to learn more, but then of course about halfway through your talk thinking this is really quite overwhelming, thinking where would somebody start out? And of course you've answered that question by giving us this app that you've developed. Could you tell us a little bit more about it, how it might help someone like me, sort of an average acupuncturist?
Yeah, so basically the app was designed as a way of just having all of the numbers and the reference ranges all in one place. And so the way that I use it, and the way that I know a lot of other practitioners use it, is you just have it on your phone. So when you're in clinic, you can just kind of, if a patient brings in their blood test results, you just bring up the app and you can just go through and just scroll through and see which of their tests are in range or not. And then seeing if there are some test results that are outside of the ideal range, you can then just click on it and you'll get some patterns where it says, I don't know if you can read in the very fine print, it says click on range to see patterns, and you click on it and you'll get the patterns that are commonly seen with that particular marker being out of range. And so they're the patterns that I describe in more detail in the book. But if you just want the summary version, then the app is a really good place to start, just to start getting your head around, what you might be likely to see in clinic. It's a really good place to start. Then you can start to see, oh wow, I've got this patient and they've got spleen chi deficiency, and all of their blood test results that are out of ideal range are all telling me about spleen chi deficiency, maybe blood deficiency, and you can start to see those correlations in clinic. For people who then wanting to know a bit more and to understand a little bit more about how, how that pathophysiology, how it works, and the different ways that you would interpret those blood test results from a conventional medicine point of view, from a functional medicine point of view, and then of course from a Chinese medicine point of view, that I go into detail in that in the book, but the app is just that summary version.
That's excellent. And I've got a couple of questions for you around, you've just talked about somebody walking in with their blood tests. So this is somebody who's obviously gone through a series of testing, say via their GP. Throughout the talk, you then also mentioned actually requesting blood tests be taken. And then you also made reference to ordering them yourself. Could you tell us a little bit about how somebody might, these different avenues to acquiring this sort of information?
Yeah. So that's a great question. Generally speaking, if people have already had, if they've got a good relationship with their GP, they've already had testing done, it's generally a good idea for them to just maintain that relationship with their mainstream care provider. And so I do ask patients, what's your relationship with your doctor like? Are you going to be able to go back and get this tested or retested? It depends. There's various reasons why you might want to retest it. If you've got things that are clearly out of range, and that might be why they're coming to see you originally. With those examples that I gave with the high cholesterol and the liver function tests, they're likely to already they've already got a time frame for retesting that they've got organised. But sometimes it might be something that's not necessarily in range, but it's not a problem, and the doctor says, "Oh, don't worry about it," or they're inside the reference range but not in that ideal range. That can be a bit trickier to go and get it retested. But generally speaking, if the patient's wanting to monitor their health and they're wanting to monitor the effectiveness of their treatment, then a lot of doctors are happy to retest. In Australia, there is some tricky kind of loopholes around tricky I guess guidelines that doctors have to follow around what they can and can't put onto Medicare and that type of thing. And in those scenarios, if a doctor is unwilling or unable to reorder the blood test, that's where we will sometimes write up a patient for having those blood tests redone if it's going to be useful. If patients are wanting to have some insight into what's happening in their physiology, and that's going to be useful for them in terms of keeping their compliance with the treatment plan, or just keeping them interested in general, then that's a great reason to do it. Sometimes if it's going to be something that's likely to change my treatment, if the information that I'm going to get from the test is going to change what I'm going to be doing, it's worthwhile doing it. But I don't necessarily advocate too much testing just for the sake of it. I think there needs to be a good reason. There's resources that go into doing this, and the patient obviously has to have their blood taken, and we're generally, bloodletting from pericardium 3, which I don't know how much, I always get my numbers mixed up, but yeah, on the pericardium channel, you just kind of think, well, how much does one person need to have bloodlet from that particular point? I try and keep that to a minimum. So only really doing blood tests if there's a real reason for it, or if they're going to be having them done anyway. Yeah, there's a few labs that we use. We've got in Melbourne here, we've got Nutripath, which is like a naturopath-based, functional medicine testing lab, and they do a lot of mainstream tests, but also more functional tests or more kind of like obscure tests. That's going to be 100% out of pocket for the patient to pay for that. And so, I like to spend my patients' money wisely. And so I'm quite judicious with the types of testing that I'll order through them. We've also got, there's other tests that I'll do with my patients. We've got Melbourne Pathology, which is like a conventional pathology lab. And so we've got referral sheets that we've got for them, and then there's other there's other testing that we will do. There might be some stool testing, and there's a specialist lab that does that, which is called Bioscreen, and they're based in Melbourne, and that's all they do is just stool testing, and they actually quantify your patient's entire microbiome, everything that's in there. It's amazing. And then there's other, a few other labs that we use as well. Australian Biologics, they're based in Sydney, and they'll do PCR testing for Lyme disease. They'll also do some food intolerance testing as well. So there's a few different labs that we'll use. There's a lab in Queensland, and they do a urine test for cryptopyrroles, and that's something we didn't get into today, but it's a condition that's linked with a lot of mental health, and so that's a really important diagnosis to make as well. So that's another test that we'll sometimes do. But all of these tests are out of pocket. You know, we're not on the Medicare system in Australia, and so I do keep testing to a minimum. If I'm going to be ordering it for my patients, it's going to cost them, you know, $100 or $200 to get the test done. It needs to provide a lot of clinical value because, you know, ultimately we've got a lot of really awesome analysis within the Chinese medicine framework, and the blood tests don't necessarily add to that. Mainly what I'm doing is looking at tests that patients have already had done, or patients that they're testing that they're going to have done anyway.
Excellent. And so my question then for you is just around, you know, this is all fairly new in terms of the idea of integrative medicine that patients having had under the care of their GP or primary clinician, and then as us as acupuncturists or TCM practitioners coming along and being an adjunct support or, you know, secondary carer. What's your relationship like with the primary carers? Have you formed a relationship with doctors based on this, or how do you feel doctors perceive you and your practice?
Oh, look, I'm sure that some of them don't like me at all, but I've got a good relationship. There's a few doctors in the area who know of me now and will actively refer their patients to me. But a lot of the time, you know, we're asking for tests that are not necessarily standard tests, and doctors don't necessarily, you know, they don't necessarily understand the full clinical implications of the tests that are done, and sometimes they'll just flat out refuse to do them. And so that can be quite tricky, leaves the patient in a difficult situation, and I try to minimise that happening. And so that's where I'm sort of talking to my patients beforehand and just saying, hey, what's your relationship like with your doctor? But yeah, look, I'll often write referral letters to, you know, to introduce myself and to, you know, just kind of frame out the scenario that's going on between our shared patient. But, you know, sadly, most of the time I don't get a reply, but hopefully that will start to change.
Yeah, indeed, and that's obviously the future of the medicine, is looking at you know, bridging the gap between the Eastern and Western medicine approach, which of course you're quite literally building the bridge between the two systems. So I just wanted to thank you again for your presentation today, and also for all the resources you've developed for practitioners like myself living overseas. The fact that you've got this online version of your book as well as the app that you've developed is a fantastic resource. And we look forward to the second book, which you alluded to. You know, we're really looking forward to seeing what you develop next. So thank you again, Clare Pyers, and we really appreciate you helping change the trajectory of our medicine.
Oh, you're welcome. Thank you for having me.